Welcome to the deep dive.
Great to be diving in.
Today we're looking at plastic and reconstructive surgery, specifically through the lens of one particular resource.
Right, a book called 100 Questions and Answers in Plastic and Reconstructive Surgery. The author is Dr. Atef Ahmed.
And our goal here is really to unpack this book, what it offers, who it's actually for, and why it's seen as, well, kind of an essential tool in this field.
Sort of a shortcut for you, the listener, to grasp a key resource quickly.
Exactly. And the format itself, that question and answer structure, seems interesting right off the bat.
Oh, absolutely. That's the first thing you notice. It's not just, chapters of text. It's 100 specific questions, each with a detailed answer.
Which presumably helps with learning.
That's the idea. It's designed for, active engagement. You're tackling a specific problem or concept with each question. It really seems to aid understanding and memory, especially in a field this complex.
Okay, so 100 questions. What kind of ground do they actually cover? The source material suggests it covers the entire spectrum of the field. That's ambitious.
It does sound ambitious, yeah. But that's what's highlighted the comprehensive coverage.
So everything from basics to advanced stuff.
Apparently so. From, the fundamental principles someone starting out needs, all the way up to pretty advanced surgical techniques. So the aim is that whether you're, say, a medical student or a seasoned surgeon, there's something relevant there. It's trying to give you the big picture and the key details.
And this all comes from one author, Dr. Atef Ahmed. The source talks about his vast experience and profound knowledge. How does that single authorship shape a book like this?
Well, it often brings a really cohesive voice, and practical wisdom. The source mentions unparalleled depth and clarity coming from his experience.
Meaning it's not just textbook theory.
Exactly. It's knowledge filtered through actual practice, through years in the operating room. He can anticipate the tricky parts, the common questions, maybe pitfalls that someone less experienced might overlook.
And that practical side seems key. The source mentions the answers aren't just dry facts, but include practical advice, tips, even ethical points.
Yes, and that's so important in surgery, isn't it? It's not just about the what, but the how and why.
Navigating patient scenarios, making judgment calls.
Right, all those real-world complexities. The book apparently weaves these practical elements, maybe advice on a tricky step, or nuances in patient selection, or ethical flags directly into the answers.
So it reflects how surgeons actually have to think and work.
That seems to be the goal, learning the practice, not just the theory.
Which makes sense, especially, like you said, in a complex field, and one that's described as rapidly evolving. How does a book, even a recent one, keep up?
That's always the challenge, isn't it? The source does say it incorporates the latest advancements and innovations. The aim is to keep readers abreast of cutting-edge techniques and technologies.
So it's trying to be current.
It has to try, yeah. In plastic surgery, things change fast. New techniques, new materials, refinements all the time. A good resource needs to reflect that, or at least point towards it. Maybe it touches on newer microsurgery approaches or something.
Okay, so let's talk about who this is really for. The source breaks it down. How does it help, say, medical students?
For students, that Q&A format seems ideal. It's very direct. Instead of wading through long chapters, they get specific questions answered clearly. Great for building that core foundation, especially when time is tight.
Helps them focus, maybe?
Yeah, identify the really crucial stuff quickly.
And then for surgical residents who are already deeper in.
For residents, it looks like a tool to deepen their knowledge significantly and critically for exam prep.
Ah, the boards.
Exactly. Board exams, specialty certifications. Tackling those questions is like self-assessment. It builds confidence, reinforces what they know, and maybe flags areas they need to revisit before hitting complex clinical practice.
Okay, makes sense. What about practicing surgeons? They're already experienced.
Well, even experts need to stay sharp, right? And keep updating. The field moves.
Sure.
So for them, it could be a quick reference, maybe refresh knowledge on a procedure they don't do often, or see Dr. Ahmed's perspective on refining a technique or get up to speed on a newer finding mention. It's part of that continuous learning process.
And it also mentioned other healthcare professionals, not just surgeons.
Yeah, that's interesting. Nurses, physician assistants, therapists, anyone working alongside surgeons in this area.
Why would they need it?
Well, understanding the procedures, the potential issues, the post-op care, it's vital for good teamwork, for collaborative care. This could give them clear explanations to help them support patients better and communicate effectively within the team.
Okay, so if we pull this all together, this book, 100 Questions and Answers, really positions itself as a pretty versatile tool.
Yeah, for learning, for self-testing, for staying current across different levels.
And that Q&A structure, the practical focus, the expert voice, it seems geared towards efficiency, getting solid knowledge without getting bogged down.
That structure is definitely key. It's not just information, it's like a learning aid. You can quiz yourself, look up specific things quickly, get focused insights. It feels built for busy professionals.
Right, practical utility.
Exactly.
And thinking about that busy professional life and going back to that point about this field being rapidly evolving, it raises a bigger question, doesn't it? Given how fast plastic and reconstructive surgery changes, what is the best way for professionals to really make sure they're always practicing with the absolute latest knowledge, the best techniques?
That's the million-dollar question in medicine, really. Constant learning, critical evaluation.
It's a huge challenge, and it underlines why resources like this one, focusing on currency and practicality, are probably so valuable. Definitely something for you to think about as you perhaps explore this field further.